Ever wondered why your newborn seems unsettled even after breastfeeding? You're not alone. Breastfeeding is a beautiful journey, but it's not without its challenges. One of the most common issues new mothers encounter is latching difficulties. This occurs when the baby is not properly attached to the breast, leading to inefficient feeding and discomfort for both mother and child. Another issue is sore nipples, often caused by incorrect latching or frequent prolonged feeding sessions. This can make breastfeeding painful and stressful for the mother. Then there's the concern of low milk supply. It's a common fear among new mothers that they might not be producing enough milk to meet their baby's needs. And let's not forget breast engorgement, a painful condition where the breasts become overly full and hard, making it difficult for the baby to latch. Remember, each problem has a solution, and we're here to explore them together. Now that we've identified some common breastfeeding challenges, let's dive into the solutions. Firstly, latching difficulties are a common issue many new mothers face. If you're struggling with this, don't hesitate to reach out to a lactation consultant. They're trained specifically to help with breastfeeding challenges and can provide hands-on assistance. Additionally, trying different breastfeeding positions can also help. Remember, what works for one mother may not work for another, so don't be discouraged if you need to experiment a bit. Moving on to sore nipples, these can be a result of improper latching. So, learning and practicing the correct latching techniques can go a long way in preventing this discomfort. Moreover, there are various nipple creams available in the market that can help soothe and heal your skin. Now, let's talk about low milk supply, which can be quite concerning. To increase your milk supply, try to feed or pump more frequently. The more you empty the breasts, the more milk your body will produce. Staying hydrated and eating a well-balanced diet can also contribute to maintaining a good milk supply. So, don't forget to take care of your nutritional needs as well. Lastly, we have breast engorgement, a condition where your breasts become overly full and painful. To alleviate this, frequent feeding can help as it ensures that your breasts don't become overly full. Applying warm compresses before feeding can help stimulate milk flow, while cold compresses after feeding can help reduce inflammation and relieve pain. Remember, breastfeeding is a journey, and like all journeys, it can have its bumps along the way. But with patience and the right information, you can navigate these challenges effectively. With these solutions, you can overcome these breastfeeding challenges and make this journey smoother for you and your baby. Are you concerned your baby isn't getting enough milk? Here's how to tell. One of the most reliable indicators of adequate milk intake is a regular pattern of wet and dirty diapers. A well-fed newborn will typically have at least 6 wet diapers and 3 bowel movements a day in the first month. Another important sign is steady weight gain. While it's normal for newborns to lose a small percentage of their birth weight in the first few days, they should start gaining weight steadily after the first week. Contentment between feeds is also a key sign. A baby who seems satisfied after feeding and doesn't constantly demand more is likely getting enough milk. Remember, every baby is different. These are general guidelines, but there can be variations. Trust your instincts. You know your baby best. If something doesn't feel right or you're unsure, don't hesitate to seek professional help. You might be wondering, When should I start and stop breastfeeding? Ideally, breastfeeding should commence as soon as possible after birth, preferably within the first hour. The World Health Organization recommends exclusive breastfeeding for the initial 6 months, then continued breastfeeding along with suitable complementary foods up to 2 years of age or even beyond. It's important to note, however, that each breastfeeding journey is unique. Remember, every breastfeeding journey is unique, and what matters most is what works best for you and your baby. Lastly, let's talk about some do's and don'ts of breastfeeding. Do maintain a comfortable feeding position for both you and your little one. Ensure proper latching for effective feeding. Remember to feed on demand, as your baby knows when they're hungry. However, avoid skipping feeds using a pacifier before breastfeeding is well established, and consuming certain foods and beverages that can affect the baby. With these tips in mind, you're well equipped to make your breastfeeding journey a successful one.